Hey, thanks for tuning in. Today I want to talk about a strange phenomenon I'm seeing in the past year, which is apparently healthy vegans getting cancer. And in each case, it's someone who's fairly known in the community, who's taught nutrition. They're vegan experts or, sort of the last people you might expect. Now, I don't know why these people got cancer. That's a hard question, of course. We can only speculate. And this video isn't to try to explain what exactly may be going on. People get sick. Some may die younger than expected from time to time, and that can happen to anyone, including vegans. But I just want to have a conversation, and I want to talk about 4 vegan cancer cases from the past year, all being high-profile vegans, and then open up a discussion below in the comments to hear what you think about it, what impressions you might have, if any. So it seems like there is a spike going on, at least from what I've become aware of, people following a healthy plant-based diet and getting a cancer diagnosis. There have been some isolated cases in the past that I'm aware of. In 2017, dietitian George Eisman died of lung cancer. He was the director of nutrition for the Coalition for Cancer Prevention, an organization devoted to educating the public about the power of a plant-based diet to prevent cancer. Dr. T. Colin Campbell said that Eisman played a big part in getting his Cornell plant-based course off the ground, which eventually evolved into Colin's Center for Nutrition Studies, the Plant-Based Nutrition Certificate. Before that, a chiropractor named David Engle, who worked for a while at True North Health, the water-only fasting clinic, he died in 2009 from liver cancer. So that's 2 cases I was aware of over maybe the past 10 years of people who were teaching plant-based diets getting cancer. Until this year, when there are 4 that I know of, people who are active in teaching about plant-based diets. Okay, a healthy, low-fat, plant-based diet, along with a healthy lifestyle, can lower your risk of cancer. Of course, there's no guarantees. Things can happen, but generally we know this is true and it's been shown in a lot of research. Dr. Joel Fuhrman has said you can basically zero your risk of some cancers using his diet.
Heart attacks, strokes, dementia, and most cancers, most common cancers, like breast cancer, colon cancer, prostate cancer, are completely avoidable.
Dr. Fuhrman says breast cancer is completely avoidable following his diet program. Well, let's take a look at one of Dr. Fuhrman's biggest fans and followers, a woman named Cheri, someone who is not just a longtime follower, but she actually teaches Dr. Fuhrman's diet to others. She's made over 700 YouTube videos. Most are teaching the nutritarian diet. Then about a year ago, Cheri posted this video titled, "Yes, I Have Breast Cancer," and here's what Dr. Fuhrman has to say about it.
So if you've read the title of this video, heavy topic, huh? I have breast cancer. I haven't been talking about it publicly at all. I wanted to sort of go through most of the treatment privately.
I'll put a link in the description to this full video, and I wish Cheri all the best. She seems very nice. And the good news is, in a video she did several months after this one, she says she is now cancer-free. So that's really great news, and I'm very happy for her. Cheri said her medical treatment was a lumpectomy followed by radiation, then the drugs Lupron and tamoxifen. She asked Dr. Fuhrman what it says about the nutritarian diet that someone like her, someone who teaches his diet, would get cancer.
Can you answer this for anyone watching this that would see me, of all people, get cancer at age 38? Well, if Cheri can get breast cancer, what point is there in eating this way? That's my first thing that I want us to touch on.
Now, Dr. Fuhrman gave a very long answer, about 6 minutes long. I'm not going to play it all here. You can go watch it if you'd like. But basically, he said that his diet lowers risk, but that doesn't mean someone might not get cancer. He said he could get cancer, that there's a lot of factors at play, and we can't really know. He also said that Cheri probably had a very bad diet as a child, and that to overcome and prevent cancer, she needed to be a perfectionist, that basically she didn't do his diet right in order to overcome her bad childhood diet. Dr. Fuhrman says that other people following his diet can learn from Cheri's mistakes. And here's an excerpt. I've sped it up a little bit so that it's not too long.
And that's why I advocate where people consider my advice to be so radical or perfectionism, that I want people to have a body weight with a BMI below 21. I want them to eat all such a healthy diet and not have any sweets, oils, fried foods, junk foods. I want them to do everything right, is because I'm cognizant of the fact that they live so unhealthfully the first half of their life. And I know that moderate nutritional improvements are not sufficient to undo that early life damage in all cases. It can undo some of the early life damage and reduce risk. I'm not saying there's not a benefit to making those moderate changes, but if we really want to see a predictable and dependable prevention of breast cancer, we need people to do excellent nutrition and not just dabble in this and not go on and off it and not do that and keep overweight. So I'm sorry, I'm not placing any blame on you, because a lot of it has to do with something to do with what your mother's diet was during your pregnancy, and what she ate before she even got pregnant affects her daughter's risk of breast cancer. And the fact you're getting it earlier in life shows the causes were earlier. Later in life, later causes, earlier in life. Earlier, we have kids with childhood cancers. It's not what they ate in the first 4 years of living. It's what their parents, what the mother ate, even before she got pregnant, affects your risk. So this is so much of an unknown here, and the risks, the damage to the DNA that could have resulted in cancer now could have occurred very early. And the only learning experience here is that, is there anything you could have done? Well, what's the point if you don't want to berate you with things you did wrong, but for other people to learn from it? Maybe you didn't jump into this program with both feet. Maybe you still dabbled with a foot in both worlds. And maybe your weight fluctuations, staying a little bit of overweight and not being careful enough on this early enough was allowed this damage that occurred even in your childhood or in your infancy and childhood to manifest in cancer now. Whatever it is that at this point, it may be an encouragement for somebody else to really take charge of their health and do the best they can. And the fact that even you at this point of having a early life breast cancer, but it's not an aggressive breast cancer.
Right.
It's relatively slower growing breast cancer. And the slower growing breast cancers can be, you can control their growth by keeping your estrogen low, your body fat low, eating excellently, and you could live a life and be protected the rest of your life. But obviously the underlying message here is, if we're going to do this, we might as well do it all the way.
Yeah, for sure.
Why do it and still have those risks? And once you have a disease like you have now, is that you're going to do everything possible now to do the best you can. You're not going to, because there's no point in taking any chances. And doing a nutritarian program 100% is even more fun. It's just hard for people to realize.
Yeah,
it's not hard to do this 100%.
So Dr. Furman is specific that to avoid cancer following his diet, it calls for perfectionism, keeping your BMI below 21. So, for example, if you're 5'2", like Cheri says she is, she needs to have a weight below 115 pounds. No sweets, oil, or processed junk foods ever. Do everything right. No cheating. He's basically saying be more committed than Cheri was. Don't be a dabbler as Cheri might have been. And again, don't become overweight. The implication here that I'm getting from what Dr. Furman is saying is that if Cheri had done Dr. Furman's diet properly and fully, she probably could have avoided the cancer. It's kind of like, my diet works, you just didn't do it right.
Heart attacks, strokes, dementia, and most common cancers, like breast cancer, colon cancer, prostate cancer, are completely avoidable.
Maybe Dr. Furman should add a sort of disclaimer so as not to be misleading, that they're not actually completely avoidable, or that you need to do a better job at following his recommendations than his star teacher on YouTube with 700 videos on the nutritarian diet did. Okay, another case is a woman I know personally. She followed Dr. Furman's diet for maybe 20 years. She used to come to my expos every year. She started coming in the early 2000s. She came the first time in order to meet Dr. Furman in person. She went on to work for him, both helping set up his supplement business, and then she was part of his coaching program. That's Dr. Furman's nutrition certification program, and she was certified and taught the nutritarian diet with Dr. Furman. Now, I'm not going to name this woman because she died of cancer last year at age 49, which is extremely sad. She's a lovely person. She was, and it's a tragedy. If you know who she is, you know that she was an amazing person who left a big hole by dying so young. There's no guarantees, even for people following a healthy lifestyle. And I don't want to single out Dr. Furman for patients getting sick and dying. Dr. McDougall told me about a patient of his who died. It was on one of his Costa Rica getaway trips where he took groups of people, hundreds of people, to these beach resorts where they ate McDougall food and heard lectures at night and did fun stuff during the day. And while ziplining, a guy who had reversed his heart disease many years earlier after going through Dr. McDougall's program, the guy was coming across on a zip line, and Dr. McDougall says that he had gone first and was waiting. And as the guy came into the platform, he was dead. He had died during the zip line ride, and they couldn't revive him. He was 92 years old, so it wasn't someone dying young, but, people die, and they can die following this program or that program. It happens. Another vegan who died of cancer recently is another woman, someone who had been vegan for decades, was super fit. She worked at an all-vegan organization for many years, and she died a few months ago, only 52 years old. She had a kind of cancer that the vegan diet should lower the risk of. Next, the wife of Dean Ornish, one of the most famous plant-based doctors out there. His wife, Anne, who is co-author of the bestseller Undo It. Anne Ornish was diagnosed recently with breast cancer herself. She's been posting on Facebook about her treatment and having a mastectomy. She's been talking about it on social media a lot.
I was recently asked in an interview, what would you say to those who would discredit lifestyle medicine because of your breast cancer diagnosis?
I am wishing Anne Ornish all the best and a speedy recovery, another lovely person. So what is going on here? 4 high-profile vegans in 1 year, people who all teach how to follow a healthy plant-based diet. The obvious answer is, we don't know. Cancer is complicated. One thing that pops into my head, and I'm speculating, has to do with supplements. Supplements can be problematic, both because some supplements contain ingredients that may be toxic, or they can be problematic to take large doses of one substance that could crowd out other important nutrients being absorbed. And then some supplements are shown to increase cancer risk. DHA supplements fall into that category. I've made a series of videos on DHA supplements and cancer, and you can watch if you're interested to see the studies that I show. I'll put a link to the playlist. But it's pretty clear from a number of well-done studies that were done by unbiased researchers, not DHA sellers, that there's a potential for increased cancer risk when you're taking DHA supplements. And this is something that Dr. Clapper has discussed and pointed to when he reversed his own position on DHA and no longer recommends DHA supplements or even getting omega-3 blood tests. One of the people who caught onto this early, I think, the potential risks of omega-3 fats and cancer is Dr. McDougall. Here's a page from Dr. McDougall's website. He wrote this in 2002, that's 20 years ago. Here's what he said. In a recent study using rats, investigators found that 3 weeks after transplantation of colon cancer cells into their livers, that those on fish oil, omega-3, had 10 times more metastasis, cancer cells that spread, in number of tumors, and 1,000 times more metastasis in volume of cells than those on a low-fat diet. Using safflower oils, omega-6, there were 4 times more metastasis in number of tumors and 500 times metastasis in volume than those rats fed a low-fat diet. Similar cancer-promoting effects of these good omega-3 fats have been seen using animal studies with lung cancer cell lines. And further down, Dr. McDougall notes, the animal studies discussed above, as well as many others in Animals and Peoples, see McDougall Program for Women book, show low-fat diets inhibit the growth of cancer and prolong a patient's life. So the diet highest in omega-3 fats made cancer cells in rats explode with growth compared to rats fed a low-fat diet. There have been a lot more animal studies done with DHA since these in 2002. You can do a search and see the results, and they're all in the same direction, that higher omega-3 raises cancer risk. And it's the DHA, it's the omega-3, it's not the fish source that seems to be problematic. Regarding animal studies, I oppose them. They're cruel, and obviously they don't always give useful information or information that applies to humans. But animal studies like these are used and accepted. A major pharmaceutical product was released for the public this year, and the only study that had been done on it was done in 8. So the use of animal studies for human health by the medical world is why I might talk about them from time to time, even though I may myself question their validity often. And in this case, that animal research showing that DHA raised cancer risk in animals, the same thing that's seen. It's the same that's seen in studies on people and DHA supplements. I covered that in my video in the playlist. One thing that is strange is that I know longtime vegans who for years have attended our Healthy Lifestyle Expo events here in Los Angeles, who follow healthy plant-based diets like Dr. McDougall or Dr. Elston's diet. And some have been in touch through my newsletter and report having sudden serious health problems like TIAs or a stroke or neurological problems in the past year or so. I read a letter to the editor of the BMJ from a professor of oncology at St. George's University of London saying he is witnessing a lot of new cancers in his patients after a pharmacological product. He writes, as a practicing oncologist, I am seeing people with stable disease rapidly progress after being forced to have I can't say this word on YouTube, usually so they can travel. Even within my own personal contacts, I am seeing B-cell-based disease after the product. They describe being distinct unwell for a few days to a week after the product, one developing leukemia, two work colleagues, non-Hodgkin's lymphoma, and an old friend who has felt like he has long since receiving his product and who, after getting severe bone pain, has been diagnosed as having multiple metastases from rare B-cell disorder. So here's another potential possible explanation for some cancers that are currently happening. Hopefully researchers are looking into this. It's nothing new that pharmaceuticals can harm people. There's a lot of research on the subject. Here's one. Our prescription drugs kill us in large numbers. In my next video, I'm going to discuss ways to lower your risk of diseases or side effects when they may be related to pharmaceutical products, so keep an eye out for that video. Of course, the answer on why we're seeing cancer increase could come down to what Dr. Furman says, that people may be eating a plant-based diet, but they aren't eating a very healthy one. They're not eating the one that makes you stay thin. They're cheating. They're eating, more junk food than they should. So that's probably a possible explanation for what we're seeing as well. I don't know. What do you think? That's it for today. Let me know your thoughts in the comments. Please give the video a like if you enjoyed it, and I'll see you on the next one.